Start பண்ணிக்கலாம்.
Good afternoon, everyone. Thank you for finding time and visiting today's webinar. I am Mrs. Magarani, moderator of this series. First of all, I would like to thank our God Almighty for His endless blessings. It is my great privilege to thank our management, board of directors, technical peoples, viewers, and people on and off the screen for their continuous support. Amniotic fluid, the protective liquid surrounding an unborn baby, is discarded as medical waste during cesarean section deliveries. However, there is increasing evidence that this fluid is a source of valuable biological material, including stem cells, with a potential for use in cell therapy and regenerative medicines. How many of us know this? It became trending now. Please join with us to know about more about the treatment with Amnion. So here we have an eminent personality, Dr. Shanti MD, Assistant Professor, Jason University, Ministry of Higher Education, Jason, Kingdom of Saudi Arabia. She will be presenting the topic on helping horse wound heal with Amnion harvest. Many of them will queue with a question. Don't worry, we have separate time for question session. Just write them to the chat box. We will answer at last. So the agenda for the day is welcome address, topic presentation, question and answer, vote of thanks. Now I invite Dr. Jansi Helena, Principal of Sri Abhirami College of Nursing, who is the convener of this series, to give welcome address to introduce the topic. Yes, ma'am, you can proceed, ma'am.
Good afternoon, one and all, and welcome you all for the 7th webinar series. First of all, I would like to thank God Almighty for organizing such a wonderful presentation for this day. And also I thank management for their untiring support and guidance throughout this webinar series. I take privilege to introduce today's guest speaker, Dr. Shanti, MD. She's Assistant Professor of Jason University, Jason, that is in Kingdom of Saudi Arabia. She specialized in obstetrics and gynecology, and she's completed her PhD in Adiparashakti College of Nursing.
மேம் என்னாச்சு அது ஸ்டக் ஆயிடுச்சு. அதான் அவங்க பாருங்க மியூட் எடுத்து தான் பேசிட்டு இருக்காங்க. அவங்களுக்கு இன்ஃபார்ம் பண்ணுங்க. அவங்களுக்கு மியூட் ஆயிருக்கு. ஆமாம் மியூட் ஆயிருக்கு பாருங்க. செவன்ராஜ் தான் மியூட் ஆயிருக்கு பாருங்க. கீழே இருந்து பேசிட்டு இருக்காங்க பாருங்க. செவன்ராஜ் லெஃப்ட் மீட்டிங் வருது. இப்போ வந்துருக்கு பாருங்க.
I'm sorry for the
Thank you, ma'am.
interruption. So I'm handing over the session to Madam. Please take over.
Okay, ma'am. Am I audible, ma'am?
Yes, ma'am.
Thank you, ma'am, for your kind words about me. A warm good afternoon to one and all. First, let me thank the management, Sri Abhiromi Institutions, Sri Abhiromi College of Nursing, the most respectable principal, Dr. Jancy Helena, the coordinator, Dr. The Mercy, Irene Mercy, and today's the organizing secretary, Professor Shobia. I'm thanking them for giving me the wonderful opportunity to present the important and also recent technology topic in front of you. So let me share my screen. Is it visible, ma'am?
No,
Hello?
ma'am.
The
No,
slides
ma'am.
are visible, ma'am? No?
Please,
No, ma'am?
no, ma'am. No, ma'am. Please try once again, ma'am.
Is it okay, ma'am?
Yes, ma'am.
Okay, ma'am. So today I'm going to discuss about helping horse wounds heal with amnion, that is amnion Norvest. So in the topic itself, we can understand the amniotic membrane has lot of advantages for healing of many disease conditions like diabetic foot ulcer, burn or wound of ocular surfaces, deep wounds, burn injuries, surgical incisions, and also venous leg ulcers. So we will see detailedly about how it can be preserved and how we can utilize the amniotic membrane in detailing. Am I audible, ma'am? Hello?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, I am Dr. Shanti MD, Assistant Professor, working in College of Nursing, Jasan University, Ministry of Higher Education, Kingdom of Saudi Arabia. So, before going to the amniotic membrane, we should understand the terminology. It's called cell transfer technology. So, it is nothing. It is one of the method of stem cell therapy. So, nowadays it is a very effective method. What they will do means through the ex vivo means outside the organ, they will expand the cells. They will transfer into the scaffold materials, including the hydrogels. Here, scaffold materials means nothing. They will use any cells to regrow. They will use some basement membrane, that is either aluminum or steel. They will utilize for cells to grow, and they will use along with hydrogels because it is a very effective method. Hydrogels is nothing. It is a less polymer and a more water therapy. So it will regrowth and repair of damaged epithelial tissues. So that is called cell transfer technology. What I have shown the picture is called hydrogels. So among these, the amnion is the best method. It will use as a scaffold material for the cell transfer. Why means it has good elasticity. We all know amniotic membrane is a very thin layer. So because of thin layer and also it has more elasticity stagnation. So they will use for anywhere and any conditions, and it has more flexibility and high successful rate of cell transfer. This amniotic membrane is a biological membrane. It forms the amniotic sac, which provides and which keeps and protects the amniotic fluid and also embryo inside the uterine cavity. And how we can get this amnion means only after delivery of the placenta. Once the baby deliver, the placenta will be come out in the third stage of labor. That time they will preserve the placenta and take out the amnion either in the cesarean section or in the normal deliveries. Next, the membrane. We all know the amniotic membrane will be comprised of two layers, is amnion and chorion. Amnion is the inner layer, chorion is the outer layer. So this amnion layer, it will use for dermal burns, ulceration, necrosis, and severe inflammation of eyes as a dressing material. Why means it has many properties, components are there in the amnion. But best if they are identified means there are three. That is anti-microbial therapy, anti-fibrosis therapy, and angiogenesis. Because of these three components, the amniotic membrane can be used in various or variety of conditions. So antimicrobial therapy means it prevent infection at all. If amniotic membrane they are transplanting, they are harvesting means it won't give any inflammation or infection to the any part. And also angiogenesis means it provide new blood vessels. It make the new blood vessels to growth. And anti-fibrosis means, so for example, we all know the allograft. Allograft means nothing. Any tissues or skin or organ, anything will be transferred from each same person to another area. For example, skin from one place they will take and to another place they will make the skin graft. So in that condition itself, the person will get more complications like rejection or bleeding or scar formation or inflammation. Many complications will arise even the allograft. But amniotic membrane, it won't have any like a scar formation. That is called anti-fibrosis property. No scar formation at all through the amniotic membrane. So you can see here in the picture how they are taking the amnion from the egg membrane. So there are two layers will be sticky like amnion and chorion. The amnion they will take remove from the chorion and it will be used for the high hydrostatic pressure. Why means they will remove the cells. Why they are removing the cells means all living, because already amniotic membrane have some living cells, because it is protects the baby and secretes the amniotic fluid inside the uterine cavity. So that all living cells they want to remove, make the new growth of new cells once they are transferred. So for that they will remove all living cells and tissues. That process is called decellularization. So this in the picture we can see easily. So human amniotic membrane, that through the chapping method, they removed all living cells. See the cells are all, everything will be removed. So only the matrix they will use. Matrix means they are not damage any structural integrity. They are not affect the structural proteins or functional protein. Only living cells they removed, and that they will store either as a injection therapy or gel therapy. They will utilize for many conditions. Here the picture given the example for MI, that is myocardial infarction. They will use the amniotic membrane injections. So how it helps means it will make the contractility of the heart and also make the ejection reflex. So this will improve the blood circulation to all over the body. So like variety of conditions, the amniotic fluid will be used in the many process. So this decellularized amnion was used for the cell transfer. Next we will move on to history of human amniotic membrane transplant. So now we can understand the amniotic membrane is a transplant is not a newer technology. Even in they were used in the older days, but because of many failure rates, it was not published out. So in the 1910 itself, they were used amniotic membrane for reconstructive surgery and also wound healing research, but it was completely failure rate. So they are not published anything. And 1940, the first documented by D. Roth doctor, they used the amniotic membrane for conjunctival reconstruction. Here also, the many failure rates, it was not used again. In 1977, the 50% successful rate was there, where they used amniotic membrane for dressing of second and third degree burns for the children. And in 1982, again only 50% successful rate. They were used for the coverage of facial derm abrasions, complete. Then in 1990s, what they have used, the newer technology is called cryo-preservation. So they are, instead of using the fresh amniotic membrane, what they have decided that the amniotic membrane can be preserved for long-term use. That is called cryo-preservation. So it will be used anytime for wound care and reconstructive surgery. So because of the many failure and only little success, they have used little by little. And in 2008, human amniotic membrane transplant, they add in the ophthalmologic reconstructions. This is about the history of amniotic membrane. Next, we should know what are the sources the stem cell can be harvested. Because if we are knowing only, we can able to understand the amniotic membrane. There are three sources the stem cells can be harvested. First one is neonatal, adult, and embryonic. In the neonatal, there are four sources. They can be harvest the amniotic, harvest the stem cells. That is umbilical cord blood, Wharton's jelly, that is in the umbilical cord, and amnion and placental tissues. These are the four things they will utilize for the stem cells in the neonatal period. In the adult period, they will use the bone marrow, skin tissues, and neural stems, then induced pluripotent stem cells. All will be used for the stem cells for the adult. Then for embryonic, they have found that embryonic stem cells are more effective and it has good stem cells, even though they have not tried anything. They didn't do any trial because of the many controversies for doing the trial for embryos. So it was dropped because of only this neonatal and adult cell sources. Different tissues were they can able to regrowth. That is either blood, immune, bone, cartilage, pancreatic, skin, hepatic system, and liver, endothelial, neural, adipose tissues, and dental. All the tissues they can make regrowth of the through the stem cell therapy. So now we can understand about how the stem cells they can utilize from the various sources. The next important thing, in the pregnancy itself, there are three sources they will utilize the stem cells and also scaffold materials. So first one is fetal membranes and umbilical cord and placental tissues. The fetal membranes, especially the amnion, they will use. Through the umbilical cord, they will use the stem cells and also placental tissues. They can use the two varieties like stem cells and also scaffolds. Stem cells they may use for say hematopoietic stem cells, mesenchymal stromal cells, and amniotic epithelial stem cells. And scaffolds, already I have said, all living cells they will remove only through the scaffold materials. They will regrow the new cells. So for these scaffolds, they will utilize for biological dressings, hydrogels, sponges. For all purpose, they will utilize these scaffolds. Next, we will see the basic about amniotic membrane. Here the amnion is a two fetal membranes which engulfs the embryo during the intrauterine development. We all know amnion is the covering of the embryo in the uterine cavity. It is called amniotic membranes. It rupture only at the time of birth and deliver together with the placenta. Amnion usually it has 0.05 to zero 0.2 mm thick. I said no, it is very thin layer and also very transparent and shiny. Okay, so it is a shiny and tough membrane. It composed of, in the picture itself you can understand, the amnion membrane is composed of 5 layers. Inner layer is called cuboidal and flattened epithelial cells. This only will be utilized for many many transplants. And basement membrane, compact layer, fibroblast layer, and spongy layer. So this way, how the amniotic sac will be developed from the blastocyst in the day 8 of the fetal period. So the amniotic sac will be developed little and day 20 and day 40, through the signals of the embryo, the amniotic sac will be developed properly. And 17 to 19 weeks, only nearly 400 ml of amniotic fluid will be there. But at the time of term, it will be increased to 800 to 1000 ml of amniotic fluid. Now we can think how the amniogenic cells will be activated inside the uterine cavity. It is very important to produce amniotic fluid and many nutrients and protects the baby from temperature, supports all many advantage it will do. So we can use the amniotic membrane outside, means it is also have so much advantages. So this is the placenta. Once the placenta delivered, we can see the amniotic membrane. That is, it has two surface, maternal and fetal surface. What we are seeing in the picture is fetal surface, where the umbilical cord attached. This is very shiny. This is the amnion, what we are seeing. Amnion will be covered the embryo through this opening only. The fetus has come out. So this amnion they will separate from the chorion and placental tissue, and they will store for the further utilization. Next, we should know what are the properties of amniotic membrane. So why it is using means because of the many properties are there. That's why it is very important nowadays. It is easy and unlimited availability. We all know because that no, it is not only used only for normal delivery. It can be used either in the cesarean section also. That's why now the birth rate is increasing. So in anywhere we can get the amnion, and it is easy to get, and also unlimited availability and possibility of preservation for the future use. We can use even the cryopreservation method. We can utilize the amniotic membrane for the future use. It is not immunological rejection. Okay, because of the no immunological rejection, it won't have any like a rejection rate, like a even even any transplant you can see, either kidney or liver or heart or lung, any transplant the patient may go for the rejection rate. But here amniotic membrane, it has no immunological reaction, it won't have any reaction to the immunological, so no rejection will be there. Then antimicrobial properties, it won't give any infection or because we all know anything if we are keeping other than the skin in the wound means what happens, some reaction may taken, isn't it? But in the amniotic membrane, if you are applied on the open wound, it will make the wound to be healed, because the cells will be growing, a tissue will be growing newly, and blood vessels will be formed, and the wound will be healing soon because of the this. But because of antimicrobial properties, it won't give any infection at all. Then anti-fibroblastic activity, I already said, the any even the allograft itself, the patient may go for the fibrosis, that is scar formation, but the amniotic membrane won't give any scar formation in anywhere in the transplantation site. Then promoter of cell migration and growth, I already said, because of it has many components, it will make the promotion of cell migration and also growth of, because you are removing all the living cells, and then only they are making the preserving of amniotic membrane. So that amniotic membrane, if they are utilizing, means because already it has some the structural properties like structural proteins and functional protein, it make the cells to regrow once it is applied in any part of the body. And induction of epithelial cell differentiation, it's again very important. It will make the differentiation of both cells like epithelial and also goblet cell differentiation. So we can see through the microbiological studies, we can see the differentiation, how it is developing the two cells within 7 to 15 days. It will be applicable. So in the picture we can see, I already said the amnion membrane has 5 layers. So what it will do means it will prevent the bacteria to be entered. So membrane will be getting disruption. So it makes the direct bacteria killing, and proteins, antimicrobial peptides. It will make the cells to regrow. Anti-endotoxin activity. So it prevents the clot formation and bacterial opsonization. And it has glycosidases activity on biofilling. And why glycosidases means it makes the glucose to make the cells to be grow, because cells needs energy, isn't it? Then protease activate on biofilling. All will be makes the protein to be good for good wound to be healed. So it has chemotaxis activity like mast cells, macrophages, neutrophils, monocytes, lymphocytes, and dendritic cells. All will be formed in the wound site. So it will make the any infection arise, it will immediately it will be killing of the particular infection, either bacteria or viral, any type of infection. Next, we will move on to mechanism of action of amniotic membrane. So in the picture, we can understand the amniotic membrane has many layers: epithelial, basement membrane, compact layer, and fibroblast layer. Because of this, the many action will be arise, that is growth factor. So this layers will make the growth factors, that is it will make transforming growth factor TGF. Okay, transforming growth factors will be stimulating, and stem cells is there already because of hematopoietic in the amniotic membrane, as some cells will be there, so it will act as a stem cell, and it will form the angiogenesis. Angiogenesis means, I already said, it is forming new blood vessels. And the epithelial cells, it will stimulate the growth of epithelial cells, stimulation of various growth factors like epidermal growth factor and keratinocyte growth factors. And fibroblast, again, it prevent fibrosis. Fibrosis means scar formation by decreasing the TGF1 and TGF2, then inhibit the scar and contracture formation. Some wound, so if wound is making to heal means what happened, because of the contraction will be takes place. If big wound is there means the person will have skin tightness. Okay, the scar will be forms in the heavy in the above the skin, above the wound. So this will be reduced by using of amniotic membrane. Next, it has many macrophages, neutrophils, and T cells and B cells and dendritic cells. What it will do means it will inhibit the cells of inflammation and defense cells. I already said it is an antimicrobial property. It has. Why antimicrobial property means it has all macrophages, that is WBC related cells. So it will make automatically the inhibit the cell inflammation. So it will leads to reduce the pro-inflammatory cytokine and reduce the chemotactic of neutrophil. All will be at the end. What happened? The person will have promote of wound healing. So and regeneration. So this is the final action. What takes inside the all components are there. All layers will be activating the particular wound site. Because of this, the person may promote and rapid wound healing through amniotic membrane dressings. The person will have within 7 to 15 days the regrowth of cells and the wound will be healed very fast. They have proven in many studies. Okay, that's why it is a nowadays they are utilizing rapidly. Next, indication for amniotic membrane transplant. There are three forms of indication, either non-ophthalmic users, ophthalmic users, and other users. So, for what are the non-ophthalmic uses like dressing of burn skin? If the person is having severe burns, like either second or third degree burns, they will utilize the amniotic membrane, either preserved amniotic membrane or fresh amniotic membrane, what they will take from the placenta. They will see the picture itself, you can understand, very thin, it will be flexible, anywhere we can able to fix. Okay, it is not a rigid layer. Okay, so we can use anywhere in the wound site. So in the day 0, the person will have severe burn, and day 15, all the burns and skin lesions, everything will be disappear by application of amniotic membrane. It can be used for large skin wounds and ulcers. Then artificial vaginal reconstruction. So what do you mean by artificial vaginal reconstruction means? If the adult, like adolescent girl, if she is not having any menstrual period means, they will find the girl will not having vaginal opening at all. So that is like vaginal atrophy. Okay, so for that they will go for the vaginal make the artificial vaginal opening. For that they will utilize inside the lumen the amniotic membrane, they will utilize for the vaginal reconstruction. So artificially, so some like the girl will have like a, she won't feel any like a loss. Okay, so for that purpose it will be very useful, and she will have like moisturization inside because of the amniotic membrane. Then omphalocele repair. Omphalocele means it is one of the congenital defects. The baby delivered with the abdominal wall defects, that is intestines, liver, all the organs will be come out along with the intestinal wall. So they will repair along with the omphalocele. They will cover the amniotic membrane and make the organs to be keep inside and repair the omphalocele. Then for post abdomen or pelvis or any cranial surgeries, if they are doing any surgeries for these, they will cover with the amniotic membrane means it reduce the adhesion. Adhesion means if they are any correcting means what happened, the adhesion will be taken. Once they are taking out and doing surgery and again they are making the same place also, the person will have some adhesion complication. So the amniotic membrane make to reducing of adhesion by application of amniotic membrane in the particular site. Next, we will see the ophthalmic causes. In the ophthalmic causes, it has variety of conditions. In stem cell deficiency, mainly the chemical injury. In this picture, we can see the chemical injury, complete eyes will be affected if the person has contact with the any chemical. So for this, they will utilize the amniotic membrane artificially and make the cornea to be formed. Okay, so the person will have good cornea will be formation. Next is, in the absence of stem cell injury, the person will have corneal epithelial defects, corneal ulcers or bullous keratopathy and band keratopathy. So what I mean by corneal ulcer means any ulcer will be formed inside the cornea. This is the corneal ulcer. The person will have the ulcer formation in the either in the side of the cornea or in the center of the cornea. For this, they will utilize the amniotic membrane. Next, bullous keratopathy. It is nothing, complete edematous of the cornea. So due to the any surgery or increased hypertension or any pressure inside like entropic pressure. So anything, any condition, it makes the edematous of the cornea. So for this also they will reduce the edematous and they will use for amniotic membrane for correcting of this bullous keratopathy. And band keratopathy means nothing. They will have like a one of the layer, it will be forms like a in between the cornea like a band. So it is due to the calcium deposition. So this they will take out the calcium by scrapping and they will make the amniotic membrane to be applied. So this is about the band keratopathy. That is nothing. It is a calcium deposition uh, uh, because of the any cardiac conditions. Next, for conjunctival reconstruction, the first one is pterygium. Pterygium means nothing. So the conjunctiva, there is excess growth of conjunctiva towards the cornea. So that this picture we can see it is a pterygium. The conjunctival will be extra growth towards the cornea. So for this also they will take out and they will abrade all the tissues and they will make the covering of the amniotic membrane. Then next condition is conjunctivocalasis. It is nothing. It is the extra folds of conjunctiva forms in the eyeballs. So it's the surrounding of the eyeballs. The extra fold of a conjunctiva will be appears. For this also they will remove the extra folds and make the amniotic membrane to be repaired. Then OSSN. OSSN means ocular surface squamous neoplasia. So it is nothing. It is a precancerous and cancerous type of conjunctiva. So what it will do means they will either conjunctiva or cornea it will affect means they will remove the cancerous cells and make the amniotic membrane to be applied. Then limbal dermoid. So limbal dermoid means nothing. The person will have the dermoid up like in the limbal area of the cornea. The person will have new skin growth in the corneal region. Then symblyperon. Symblyperon is nothing. This picture shows symblyperon. So here the conjunctiva, that is palpable conjunctiva, will be tightness to the or it will be connecting to the bulbar conjunctiva. That is called symblyperon. It is partial or complete adhesion. Okay. So the palpable conjunctiva, it will be adhesion or completely or partially towards the bulbar conjunctiva. So the person can't able to open the eyes at all. So if you are trying means we can able to try and open and see the person will have adhesion towards both conjunctiva. So they will cut the adhesion and they will make the correction. Then conjunctival lesions, any conjunctival lesions like if the person is having any growth. See this picture, the person is having any conjunctival lesions in the conjunctival. So they will take out the lesion and make correction by the amniotic membrane. And leaking bloods. What do you mean by leaking bloods means? This is one of the complication of any post trabeculectomy. The surgery after trabeculectomy, what happened? The person will have due to the pressure and due to the bleeding will be leaking. So the person will have all blood supply like a leaking bloods will be appeared on the upper part of conjunctiva. It is a one of the danger complication of trabeculectomy surgery. So all these they will corrected by the transplanting of amniotic membrane. So now you can understand the picture. So first picture is a chemical injury and the second one is corneal ulcer, bullous keratopathy, band keratopathy, pterygium, that is extra growth of cornea, that is conjunctiva, then conjunctivocalasis and like ocular surface squamous neoplasia, limbal dermoid, symblyperon and conjunctival lesions and leaking bloods. All conditions they will utilize the amniotic membrane. In other ocular conditions like cicatricial diseases like toxic epidermal necrolysis. So it is like any erythema or necrosis forms under the high region that is in the conjunctiva. They will correct through the amniotic membrane. Then ocular cicatricial pemphigoid. It is nothing, either one side of the eye, the conjunctiva makes the scarring. So scarring of the conjunctiva is called ocular cicatricial pemphigoid. So they will remove the scarring and they will make the amniotic membrane to fuse it. Then oculopalpable and reconstructive surgery. Any eyes, if they want reconstructive surgery, they will use the amniotic membrane. And the third form of indication is other uses. So we have seen the two uses like non-ophthalmic uses and ophthalmic uses. And third form is other uses, that is stem cell culture. So I already said the amniotic membrane they will use as a stem cell culture. There are three cells they will use: hematopoietic stem cells, epithelial stem cells. All they will utilize for the stem cell culture for the amniotic membrane. So this picture shows easy to understand how the amniotic membrane will act as a tumor cells. The amniotic membrane, already I said, it has many components like endostatin, TSP1 and TSP2. It is nothing. TSP1 means like the person will have trisodium phosphate 1, trisodium phosphate 2 and plasminogen activator inhibitor, interleukin, and TIMP means tissue inhibitors of metallo-proteinase. All these components will act as a directly to the person blood vessels, that is FGF, that is fibroblast growth factor, and vascular endothelial growth factor VGF, and plasminogen activators, and MMPs means matrix metallopeptidase. All these these enzymes it will stimulate by these components in the particular person body. If the person is affecting by the cancer, okay. So once these enzymes are stimulating, what happens? The person have new growth of endothelial cell. So migration of endothelial cell, and it will make proliferation and also adhesion, all will be relieved. So making the person for good and angiogenesis. That is, new blood vessels will be formed in the particular tumor site. Okay, this how the amniotic membrane acts for the tumor cells and make the angiogenesis to be forming in the particular site. Next, even though this has many indications, some contraindication also will be there for the amniotic membrane transplant. So we should be more careful. So if the person is already having like active or latent infection, particularly in the management of persistent epithelial defects with infectious corneal ulcer, means we should not use the amniotic membrane. If the person is having already more infection, okay, especially the epithelial defect, means because we are utilizing the amniotic membrane for epithelial cell growth. Understand? So for that reason, if the person is having already the persistent epithelial infection in the eyes or anywhere in the body, we should not transplant the amniotic membrane. And second contraindication, if the person is having reaction, that is history of drug reaction to the ciprofloxacin or amphotericin B, because the amniotic membrane they will preserve through these drugs. Once they are removing from the placenta, they will clean with these drugs, and they will they will put the amniotic membrane in the preservation. So because of this, they have to check whether the person is having any drug reaction to these drugs like ciprofloxacin or amphotericin B. And third contraindication, it is only the single patient use. We can't use for again for the next patient. So this is we have to keep in mind for utilizing the amniotic membrane transplant. So what the functioning, how it function for the amniotic membrane transplant? There are two functions, that is promoter of epithelialization and inhibitor of fibrosis. So I said already the amniotic membrane is very important for epithelial cell growth, isn't it? So it facilitates the epithelial cell migration, so making the more fast migrating of the epithelial cells, and promote epithelial cell differentiation from the goblet cells, and prevent epithelial cell apoptosis. So here, like the person will have like this apoptosis. So apoptosis means nothing. It is like it prevent the vascular leak. So like if they are applying the amniotic membrane in the particular site, so it prevent like it makes normal growth of particular site. It won't affect any growth of in the older one, or it will prevent the blood supply. Nothing it will do. So that's why it prevents epithelial cell apoptosis and ensure the basal epithelial cell adhesion. It won't get any adhesion of the epithelial cell, and it inhibits the protease. So any protease in enzymes like it will forms, means it makes the infection, so it prevents or inhibits the protease enzyme. So all will be occur through the promoting of epithelialization. Then second functioning, it inhibitor of fibrosis. Fibrosis is nothing, it's a scar or stroma. So any transplant we can see like any surgery or anything, if they are doing, they may have some fibrosis or scar formation. So what it will do means it decrease the UTGF. That is, UTGF is nothing, the urinary transforming growth factor inhibition, because it is secreting in the kidney. So this will be decreased for the inhibition and also myofibroblast differentiation. So why it is inhibiting this means then only the person will not having any stroma or fibrosis, and also it differentiation the myofibroblast and anti-inflammatory effect of interleukin A and interleukin B suppression, and also A vascularity. It prevents the growth of new vessels because of the stoma is not forming. So upper part it won't have any new blood vessels will be forms. So all this will lead the anatomical barrier to keep the adhesive surfaces apart. So the person won't have any adhesion. Adhesion is taken place means the healing will be delayed. So because of these components, the person won't have any adhesive surfaces. Next, we should understand how it is safety, how the product, Amnion product is safety for utilizing. Because of we have to understand, so it is other than the occasional pain and swelling at the injection site, not observed any adverse side effects for amniotic tissue products. Okay, so sometimes the person will have pain and sometimes swelling will be there. That is a normal process of wound healing. But apart from, nothing will be, no side effects will be present for the amniotic tissue transplantation. So this is immune privilege. So the person won't have any foreign substances to be there, any bacteria or viral or any, no infection will be arised in the particular because of it is immune privileged. The amniotic membrane, it provides structural support and a plethora of growth factors. Because of no scar forms, it gives complete structure. How the person's before, how the particular site, how it was before, same like it will be there after the transplantation also. The structural support will be protects, and also the plethora of growth factors will be more new blood, new cells, new blood vessels, new cells, new tissues will be grow. The person will have easy to handling of the particular site. Then it has many 108 growth factors, even though the two most important is prostaglandin and WNT4. WNT4 is nothing, it is a one of the proteins will be secreted from the human body. Okay, so prostaglandin, we all know, usually the prostaglandin will be secretes during the time of pregnancy and also during the time of labor and also inside the blood vessels, all where the prostaglandin is very important effect in our body. So what the main action is, it inhibits the inflammation, which occurs even after surgery or before beginning of any infection. It will make the healing process because of it has many inflammatory receptors. Then WNT4 is a protein. This molecule is very required for always we know. We can say even the patients or anyone, if they want to have good wound healing means they should take good protein intake. So that's why the WNT4 is one of the protein will be secretes in our body. It will be utilized for any wound. So make the wound to be heal fast. The amniotic tissue contains interleukin also. So it is the one of the good antagonist and also tissue inhibitor of metallo-proteinase, that is TIMP 1, 2, 3, 4 proteins. This also will be very important for the suppress and also modulate the inflammation and also subsequent the pain. Okay, so for these properties, we are utilizing the amniotic membrane. So it is very safe method. That's why they are utilizing nowadays for many disease condition. Okay. How we have to prepare? So it's very important again because it is one of the like a not hygienic one, isn't it? So once it is delivered, it has many blood clots and blood stained, and we are handling many members are handling the amniotic placenta. So it has many unhygienic, and also the infection will be maximum. So how we have to prepare the amniotic membrane means, after the placenta, after selective cesarean section, so you have to consent the donor. So particular the person whether he is free from the HIV, hepatitis B and C, and also syphilis. All we have to first screening. Then with the under laminar flow, they will keep the placenta in the laminar flow hood, clean the blood clots with the sterile saline, as well as 50 microgram of amphotericin B. That's why I said it is one of the contraindication is if the person is having drug reaction to amphotericin. It's one of the antibiotic. Okay, so if the person is having the reaction to the particular drug means we should not transplant the amniotic membrane for the particular person. Okay, then separate the amniotic membrane from the chorion by blunt dissection. It is flattened on the nitrocellulose membrane like they will cut. They can't keep all will be a same. Okay, they will cut like a 4 into 4 centimeter. Okay, or if they are planned for any big wound means they will utilize according to the wound size they will cut. So with the epithelial basement membrane, so always I said the epithelial basement membrane is very important for the amniotic membrane to make the repair or any damaged epithelial cells. It will be very effective method. So how it has to then after cleaning everything, it has to be stored. If it is using in the fresh means no problem. But if they are not using the fresh, they have to store by cryopreservation. So it should be stored at minus 70 degrees Celsius in a sterile vial containing this solution. It should be inside. That is Dalbicos modified Eagle medium, and it should be a sterile glycerol in 1:1 ratio, 3.3 percentage L-glutamine, 25 microgram of gentamicin, 50 units per ml of penicillin, 100 microgram of ciprofloxacin, zero point 0.5 milligram of amphotericin B. So all will be inside. Okay, because to prevent infection, because we have to preserve, no. So we have to make it all things to be inside the amniotic that fluid. Then it can be used up to 6 months after preparation. We can use up to 6 months from the preparation, like if it's preparing today, and they can use at least for the 6 months for this utilization. The vial is thawed at the room temperature for 10 minutes or 4 degrees Celsius. Like it will be like a room temperature means like either 30 room temperature 24 degrees Celsius or 28 degrees Celsius, or like that they can keep for 10 minutes, they can utilize, or 4 degrees Celsius they will use for the 30 minutes before use. Then cellular viability, it is decreased. Okay, so new growth inside what during the preservation time, it won't affect any cells. The cells will be live inside. So 50 percentage in 2 months it will be make the cellular viability. And damage of amniotic membrane cells by cryopreservation, so it makes the decreased growth factors. So cryopreservation is very important. We have to safely, we have to store all these solution to be inside. Otherwise, it will be spoiled. We can't able to transplant the amniotic membrane at all. So if it is not properly preserved, means what happen? The person, it won't have any growth factor at all. That is, it will be decreasing the growth factor. Next important is microbiological safety. We have to see the before using, we have to whether it is safety for utilization. There is dual screening to be done for the HIV and hepatitis B, and we have to see the procurement. Procurement means whether it can be used in the fresh or we can use in the 6 months later. And next, very important, the prions like CJD. CJD is nothing. It's a Creutzfeldt-Jakob disease. It is a neurodegenerative disease. Anytime it can be appear in the amniotic membrane transplantation. So we have to watch for the CJD also. So what precaution we have to take while transferring to the patient? So we have to select the donor. We have to see whether the person is high risk for behaviors like any high risk conditions, social and medical history to be collected, then consented and screened for the donation. All to be done during the time of donor selection. Then local research and ethical committee approval. So if they are doing any patient transfer means particular hospital, they have to get the research on ethical committee approval for transplanting the amniotic membrane, and a competent lab should be there. Particular hospital, if they are preserving the amniotic membrane means they should have a competent lab for preserving or testing. Then serum samples from donor saved for 11 years post transplant. Okay, so the serum samples from the donor, they can saved for at least 11 years for the transplantation. So it should be proper storage, it should be there. So we can see whether the fresh or preserved, fresh versus preserved AMT, both will be functioning. We can ask the question whether fresh AMT will be good functioning or preserved AMT. So, but we can see here the both AMT will be having equal function. So the disadvantage is, if you are seeing means, the disadvantage of fresh AMT, it has a wastage of unused amniotic membrane transplant. If you are using the fresh, for example, we want only the small samples. So remaining they will discard it. Okay, so wastage of unused amniotic membrane and lack of dual screening. Because of the fresh, they can't able to wait for more process. So they will use the fresh frequently, okay, like a emergency purpose. So that time they may have the lack of dual screening. Then disadvantage for preserved AMT is they can store at least minus 80 degrees Celsius. It should be needed, because I said it should be in a freezer, deep freezer, that also minus 80 degree. So that facility should be there for the preserved AMT. And it is damage of sometimes amniotic membrane cells by I already said, if they are not preserving properly, the amniotic membrane cells will be getting damaged. So it will make the decreasing of growth factors. So how we can identify amniotic membrane means, so after taking the amniotic membrane, it should be stains to identify whether it is amniotic membrane or any other membranes. Means we have to use with the ICG. ICG means it is one of the stain, that is indocyanine green. It is one of the staining method, or trypan blue or lysamine green B. They will use in the time of intraoperative period, and both stroma and basal membrane should be stained. It can be identify wrinkles on graft. Okay, so we have to see during the time of graft application whether it is wrinkled or it will be straightened. Okay, all will be seeing properly. If it is wrinkled means we can't able to utilize the particular amniotic membrane. Okay, so that's why it has to preserved properly. Then stromal side as vitreous like strands when touched with a sponge. So the stromal layers as vitreous like strands. Okay, so it has like a tough membrane, tough surface will be there in the fifth layer of the amniotic membrane. So once it is touched, it should be in the preservation time, it will be very sponge like. So there are three forms they will utilize the amniotic membrane, either ambio 2, ambio 5 and ambio disc. In any form of the preservation they can use in the any conditions. Like ambio 2 means it is a single layer native amniotic membrane. The biostructure of native amniotic membrane is retained. So they won't go for maximum staining, and they won't maximum effect they will do for the ambio 2. Ambio 5 means it is a multi-layered with amnion plus chorion, because they will use both chorion also inside under the amniotic membrane. So it is very thick, intact and more biostructure. But either only amnion we can use means it is by ambio 2. If they are using both amnion and also chorion means it is thick. So we can see the picture, we can understand it's very thin. Okay, only amnion is a ambio 2. If it is thick, we want to use for more biostructures means they will go for the ambio 5. It is multi-layered, both amnion and chorion. It while touching itself, we can understand it is a very thick, intact and more biostructure. And ambio disc, it is a 15 disc. It is self-retained. Okay, so it has both amnion and chorion we can use, but only the 15 disc for small areas they will utilize the amnion disc. Next, preferred storage. Now we can understand, I already said the amniotic membrane to be stored in the minus 80 degrees Celsius. So it should be more frozen. So in which are if according to the frozen, how we are utilizing, we will see. The location, if we are utilizing in the unopened insulated shipping container, for example, containing dry ice. Okay, so if they are transferring from one place to another place, they will use the shipping container like dry ice containers. So they have to frozen at least minus 80 degrees Celsius. So within expiration date printed on the product packaging, they have to utilize. For example, if it is given expiration date 1 month or 2 months, within that period they have to utilize the particular uh, particular amniotic membrane. Then second one, it is a standard freezer. So it is a home or general use they will utilize. So in the normal refrigerator they will utilize. It should be frozen for minus 20 degrees Celsius. They can use within 3 months after placing of the product. They have to utilize, or until the expiration date printed and outer product packaging, whichever comes first. Okay, either the expiry date will be 1 month means they have to utilize, or else if they are not given any expiry date means they can use within 3 months with the freezing of minus 20 degrees Celsius. If they located in the ultra low temperature, that is freezer minus 80 degrees Celsius freezer means it should be frozen for minus 80 degrees Celsius. So how we have to use means we can use until the expiration day, expired date printed on the outer product packaging. that is definitely it will be 5 years from the date of manufacture, because it is they are making complete package. Okay, they are storing properly, like a minus 80 degrees Celsius freezer under the ultra low temperature, with a frozen of minus 80 degrees Celsius. So they can use at least 5 years. They can utilize this type of product. Next, surgical technique. So till now we have seen how the amniotic membrane to be prepared, how it has to be safely to be used, and which are the how it has to be stained. Then how it without how it has to be stored in the different conditions. Next, we will see surgical techniques. In the different conditions, it will be utilized. So before going to the surgical techniques, if the amniotic membrane should be thawed at, should be taken out from the freezer. That it should be thawed at room temperature. Thawed means from the fridge, it has to from the freezer, it has to be taken out into the room temperature. Is called thawing. So thawed at room temperature and rinsed 3 times in the BSS. BSS means the balanced salt solution. You have to clean the amniotic membrane, that is preserved amniotic membrane, then gently separated from the nitrocellulose paper. So they will cover the amniotic membrane with the nitrocellulose paper to prevent wrinkle formation. So you have to gently remove the cellulose paper, and the epithelium basement membrane should be side up. Okay, so the epithelial membrane should be it should be come for the upper part to while transplanting the amniotic membrane. These 4 things we have to keep in mind before transplanting the amniotic membrane. So, what are the conditions this amniotic membrane is utilizing means? First, it is like a overlay technique. So, overlay technique, inlay technique, and patch technique they will use for the eyes. The overlay technique means it is performed for the non-healing epithelial ulcers, persistent epithelial defects of cornea, or any chemical injury. All these 3 conditions they will use the overlay technique. Overlay means nothing. They will keep the amniotic membrane around the cornea from the from the cornea and surrounding all part of cornea. They will keep and they will make the suture in the complete cornea. So that is called overlay technique. So a single multi-layered amniotic membrane with stromal side down is secured over trimmed epithelial defect on cornea with 10 nylon suture with the buried knots. See how they did in the middle part. It's called overlay patch. See, this is the epithelium, Bowman layer, stroma, the disseminate membrane, and the endothelium. This is the anterior. It is the structure of eye. Okay, this is the lens. The blue color. The thing is amniotic membrane. Okay, so blue color is amniotic membrane. The brown under is lens. Okay, so if it is affected, what they will do means they will keep the overlay patch of the amniotic membrane. They will cover the complete lens. It's called overlay technique. Under this layer they will suture in the side. Okay, all over the cornea they will suture with the buried knots. So the knots will be buried inside the cornea. So this is called overlay technique. Second one is inlay technique. Inlay graft technique. So it is nothing, only the center of the cornea they will choose. Like they will buried into the going to the depth. So not only epithelium, they will go in depth to the Bowman layer. Whereas the overlay technique, they used only the epithelial layer, they will cover by the amniotic membrane. Whereas the inlay layer, they cover both epithelium and also Bowman layer for making the person to be correct properly. So in case of epithelial defect or ulceration with the stromal thinning, they will use this amniotic membrane. So multiple amniotic membrane layers are trimmed to fit the size of the ulcer defect. So we have to cut the amniotic membrane according to the size of the where we are fixing. Okay. So if they want only the center of the cornea, they want to do with the inlay means they will cut according to the size. They will make the amniotic membrane with the thick, that is multiple layer. The underlying layers are compactly packaging with the stromal side down and the layer by layer, because the amniotic membrane has 5 layers, isn't it? The stroma should be down, epithelial layer should be up. Okay, like that only they have to transplant. So in the before itself we have seen the amniotic membrane should be transplant as a epithelial layer above. Okay, so the stromal layer should be side down. Layer by layer we have to fill up the stromal defect and also left unsutured. Okay, so inside if it is going means we can't able to suture inside. Okay, the topmost layer only should be sutured. See, the topmost layer only they have sutured the cornea with thin nylon with buried knots. So compact packing helps good healing. So why it has means, so it is going deep and deep. So that it is a very compact layer. Okay, so it will heal soon. So here the amniotic membrane acts as a scaffold for epithelial cell migration. So what happened? So here we are using the amniotic membrane as a only scaffold. They removed all the living cells. Only the remaining whatever the inside the amniotic membrane only they are transplant. So this will be make the person for epithelial cell migration, the more growth of the epithelial cells. Then third method is patch technique. So patch technique is nothing. So they will use all like a sandwich pack. Okay, so it is always called sandwich. They will use either the center and also in the side along both technique they will use. Okay, like center part they will keep thick amniotic membrane, the multi-layer amniotic membrane. In the laterally they will keep the thin amniotic membrane for easy to fix. Whereas the overlay and inlay technique it may come out, but whereas the sandwich technique, it is fixed properly in the side and also in the center. Okay. For patching the cornea by placing the basement membrane side downwards and stromal side up. Okay. So same like we have to make the stromal to be side up. Okay. Then suture to the surrounding perilimbal conjunctiva, acts as a biological compact layer to protect the healing surface beneath it, and falls off are removed after use. Okay. So once we are used, the even the sutures will be come out simultaneously, or we can remove the sutures. This is how they will use the patch technique. And other conditions like conjunctival reconstruction. So if the person is having more conjunctival bleeding or redness of the conjunctiva or conjunctival ulcer or any lesions, they will scrape the lesion and scrape the ulcers, and they will use the amniotic membrane. See the picture, we can understand. The thick amniotic membrane, they cover complete conjunctiva. See the white part of the cornea and conjunctiva, they suture the amniotic membrane. Okay. So once they are doing that, the conjunctiva it won't get more lesions and it won't get the ulceration. So what they will do means 8 or 9 or 10 Vicryl sutures they will use for the amniotic membrane to the conjunctiva after adequate dissection and removal of the conjunctival tissues. Here the conjunctiva had some form of lesion or some of cancerous tissues or any abnormal tissue forms, like I told no pterygium. Pterygium means excessive conjunctival growth in the towards the cornea. So that they will take it out and they will use the amniotic membrane in the particular part. So what happened? The conjunctiva it won't regrow at all after that. So for that they will scrape first. Okay. So dissection or removal of the particular tissues. Then they will make the amniotic membrane to the fornix with 2 sets of double arm 4 chromic catgut sutures with cutting needles may be used. The needles are passed from amniotic membrane surfaces through the inferior fornix. See, they will use from the amniotic membrane to the inferior fornix, that is inside the canthus. Then via the full thickness of the eyelid and exit through the eyelid skin. The 2 needles of each of the 2 sets of sutured are passed to the 2 segments of an encircling band and then tied. See, they will make as a circular type of suturing. Once they will suture, they will come to the eyelid end, then they will make the knots knots will be buried. So the person won't have any rejection, or the amniotic membrane will have easy to fix also. So make the encircling band, okay, like a purse string suture, how we are used in the obstetrics for cervical incompetence. Like that, they will use the purse string suture. So the person won't have any removal of any suture at all. Okay. Next condition, corneal surface reconstruction. See how they are utilizing. So the first picture shows they use the corneal structure reconstruction. The second picture, after healing, we can't see any defect in the cornea. Okay. If any corneal ulcer or corneal cancer in the cornea, anything, any lesions in the cornea, okay, anything, if it happens, they will fix the amniotic membrane. See, after healing, the cornea will be looks good, okay, with the amniotic membrane. So the Wexel sponge or blade is used to remove the all cellular debris or exudate from the base of defect. Fine forceps and a straight crescent blade to remove loose epithelium surrounding the epithelial defect. See, through this they will scrape all the cornea. They will take the center of the cornea, that is whatever the damaged cells they will take out from the through the pixel sponge or blade. Okay, then fine forceps they will use straight crescent blade to remove loose epithelium surrounding on the epithelial defect. Then they will use the single sheet of amniotic membrane applied in the inlay graft. Okay, I said no, only center they will utilize for the amniotic membrane means it is called inlay technique. Complete cornea if they are using means it is called outlet technique. Okay, so with the single use with the inlay graft or overlay patch at least 1 mm larger than the defect. Okay, so if you want to overlay, if you are doing means some amount you can extend the amniotic membrane. And non-absorbable interrupted 10 nylon monofilament sutures are used. Okay, non-absorbable because they want to remove the sutures, they will use the non-absorbable interrupted sutures. They are not doing the continuous. See, they are using interrupted one suture, then they will cut, then again they will go for the another suture. They are not going for the continuous suture here. Okay, interrupted 10 nylon non-filament sutures are used for the corneal surface reconstruction. So this is the continuous suture how I said in the previous slide. Okay, the picture shows. So they will make the continuous suture up and down. Okay, eyelid. The sutures must be placed circumferentially or parallelly to the cut edge of the graft in an interrupted or continuous manner, or sometimes they may go for the continuous like this. How the picture shows. Okay, continuous manner we have to do. The sutures knots must be cut short and buried into the corneal tissues. Okay, once they will make it, they will suture and knots will be exactly edge we have to cut. We should not leave some of the sutures inside the eyes because this will get irritate of the patient. Okay, so it should be very cut. We have to cut the knots will be very short, and also it should be buried into the corneal tissues. In deep defects, a multi-layered approach is preferred with small pieces of amniotic membrane into the defect of a single sheet may be folded on itself twice. So if you want multi-layered can be applied means what they will do means they will fold the amniotic membrane as a single sheet. Otherwise that technique is called blanket fold. How we are folding our blankets like that we have to fold the amniotic membrane with a larger patch, then they will make the entire defect in the overlay fashion. Understand? So for full thickness if you want or a good making the good healing or more property if you want means we make the amniotic membrane as a folder techniques. Okay, that is called blanket fold. Another condition like ocular surface reconstruction. So ocular surface reconstruct complete eyeball. Okay, so complete eyeball will be affected with the chemical injury or any cancerous conditions. What they will do, all the things will be dissected. That is, cancer cells will be dissected from the eyes. Then they will apply the amniotic membrane. See how they are applied. You can see the first picture. Complete cornea is affected and conjunctiva also getting affected. Okay. So after applied the amniotic membrane, you see the amniotic membrane they have applied along the cornea, conjunctiva also they have applied. Okay. So you see new blood vessels are getting formulated. That is called angiogenesis. After new blood vessels form, you look the eyes. It's like a normal eye. Okay. The cornea is appeared. Conjunctiva also looks good. Okay. The person will have visibility of good eyes. Okay. So here all fibrotic tissue is meticulously dissected and removed from the corneal and conjunctival surfaces. Okay. So because of the scarring, all will be getting defects. The person is can't able to see at all. The vision loss will be there. The conjunctiva also gets scar and cornea also gets scar. So what they will do means they will dissected the or removed from the all the scar tissues will be removing. Then continuous sheet of amniotic membrane devoid of a buttonholes use. See, they are used the continuous amniotic membrane they have applied. They use the buttonholes. Okay, buttonholes means they will go the buried suture. It won't see outside. See the second picture in the B, we can't see any suture at all. Okay, because of they have gone the buttonhole suture, and the lower lid is everted with Calassian clamp. A large sheet of amniotic membrane is placed on the ocular surface and anchored to the inner surface of lid margin using multiple interrupted 10 vicryl sutures. Okay. So if the lower or upper, everything, everywhere, if you want to use means that time they have to go for the vicryl suture. So multiple interrupted vicryl suture used to attach the amniotic membrane to the inner lid surface, beyond the inferior fornix and to the bulbar conjunctiva. If they want to use all over the all over the eyes, that is eyeballs, if they want to use the amniotic membrane means they have to go the multiple interrupted vicarial sutures. Okay, they have to attach the amniotic membrane all over the like inner lid surface to inferior fornix and to the bulbar conjunctiva, all where they have to apply the amniotic membrane and they have to do the interrupted suture. And if they want to go for the continuous means, continuous encircling with the same 10 nylon suture is used as the anchor of the membrane at the limbus or the peripheral surfaces. If they want to use only the limbus area means they have to go for the like a continuous suture. Okay, either they will go for limbus or peripheral 360 cornea. If they want to only the limbus, they have to suture means they have to go definitely continuous. There is 360-degree. They have to do the suture and make the final tie. Okay. So these are the technique what we have used, what they are used for the surgical techniques for the different ocular conditions. Next, we should understand the explant culture technique. So there is human amniotic membrane can be used with or without its native epithelium. So nowadays, what they are saying, they can use with, or I said the epithelial tissue is very important. Okay. So through the culture technique, what they are saying, we can use either with or without the native epithelium, and the de-epithelialized membrane facilitates good visibility of culture cells and confident growth of cells. So what they will do means, if they remove the epithelium means the amniotic membrane itself, it will make the new growth of culture cells, and also it make improvement of the growth of cells. And intact of amniotic membrane retains the stem cell characteristics, promotes growth rate with better stratification. Okay. So the epithelial tissue is removed, and if it is used for the culture means they will use this as a stem cell characteristics. What it will do means it will make the promotion of growth rate with better stratification. There is better, it won't have any rejection at all. Then explant fragmented limbal tissues on the membranes. Then the cells are fed with 3 to 4 ml of medium, because we can't able to preserve as like just we can't able to preserve in the freezer. We have to be preserved within the culture technique means they have to be go for the 3 to 4 ml of medium, whatever they have said in the for preservation. Then incubated at 37 degrees Celsius and 5% of carbon dioxide, and monitor for the growth on alternative days. So we have to see after preserving, we have to see, because we are removing the epithelium. So whether the amniotic membrane is having regrowth or not. Then culture is terminated when a monolayer of cells growing from the explants becomes confluent in 10 to 14 days. So once the amniotic membrane is getting the growth of monolayer of the cells, they will take out the amniotic membrane from the preservation from 10 to 14 days for the utilization. This is about the explant culture technique for the amniotic membrane. So whatever we have seen, it's all will be good. Everything will be a more effective amniotic membrane transplantation. So some complication also it will be there. That is, sometimes if we are not doing the any dual screening. So dual screening, if we are not doing, the person may transmit the HIV or hepatitis B or C, and premature dissolution of the membrane. Sometimes the membrane may comes out, then cutting through the sutures and loss of membrane. Suppose if you are not suture properly, because eyes, it's very difficult to suture. So mild, they will do very careful and they will use very only 10 nylon sutures they will use. So for that, it may happen like loss of membrane sometimes. Then residual opaque membrane, sometimes it may forms like sometimes. Then like a stoma maybe forms. The fluid vesicles are collection of blood under the membranes, and failure of achieving the intended outcome. Some, if we are not follow up, or if the patient is not follow up in a regular, sometimes the fluid or blood may formulated under the amniotic membrane. So it will give failure rate. That is, outcome will be giving failure. Then calcification. So calcification, more calcium deposit under the amniotic membrane transplantation. So sometimes it will make the rejection and also scar formation. That is called calcification. The maximum, it was very good effective till now they have identified. Sometimes it may give these complications. So next we will move on to recent advances. Again, very important. So the recent advances of amniotic membrane fixation. So amniotic membrane transplant. The first recent advance, what they said is sutureless. Whatever we have seen in the previous slides, we have to suture. Okay, either deep or buried suture or buttonhole suture. But now what they are saying, the recently they found the amniotic membrane we can fix. Okay, we no need to any suture at all. Okay, wow means they have to use some gel, some glue or gel. Okay, so they will apply onto the cornea. So this is called sutureless amniotic membrane fixation. So what they will use means they use with fibrin glue, and suture fixation of amniotic membrane causes. So if the suture, if you are using means what happen, it will be time consuming and a cumbersome process. Cumbersome is a very like a large process. For example, if they want to suture means they have to arrange all the things like a suture material, cutting, everything like a all surgical technique, everything they have to keep ready. So that is called cumbersome process. That is larger process. Then corneal irritation or scarring will be there. So in the suture, if they are doing suturing means the patient may have irritation of the cornea, and also scar may form sometimes, and the graft also will be lost due to the membrane shrinkage. If they are sutured loosely or tightly, very tight means what happens, the membranes may shrink. Okay, sometimes, so it will get graft loss and need for subsequent suture removal. Okay, the person should come for follow up for removing of the suture. So these are the some disadvantages are there if they want to go for the suturing of amniotic membrane. So that's why now they have said sutureless amniotic membrane. So what the advantage for this sutureless means, it reduces the surgical time, isn't it? So if they are going the sutureless means they won't have any surgical timing at all. Then patient will be more comfort, and post-operative period also will be reduced. No inflammation and suture related irritation. No need to remove any sutures because it is sutureless, no, and rapid recovery will be there. But at disadvantage, if you are seeing, the cost of the glue will be very high. Okay, so tissue glue if they are using means it will be very high according to the where they are fixing. If they are fixing in the small amniotic membrane means okay. If they are fixing in the wound or big area means it will be utilized in the more glues. So the cost will be more, and the glued membrane is not as a secure as sutured membrane, isn't it? So suture means it will be fixed, but glued membrane sometimes it may come out without knowing of the patient also. Sometimes irritation, the patient may rub the eyes means it will come out sometimes. Okay, so this is very not a safe, so it may come out as not like a sutured membrane. So what other recent advances are there means, so the human amniotic membrane, it has more release factors of anti-oncogenic potential. So nowadays they are using for inhibition of prostate cancer cell growth. So they will use the prostate cell growth. Also they will use the uh, human amniotic membrane, and the combination of human amniotic membrane, they use the anti-angiogenic agents for the synergetic effects, mainly innovative potent materials for this cancer treatment. And recently, they investigated human amniotic membrane is a part of wound dressings, mainly the full thickness of skin graft. Before and all, they used only like a second degree, third degree burns, and only the not partial thickness of the skin graft only they used. But now, what they are identified, even the full thickness skin graft also the amniotic membrane can be utilized. Next, recent advances, the placental allografts, now it is emerging. It will be used for the periodontal plastic surgery for teeth corrections. They are utilizing the placental tissues, and fetal membranes mainly, like it is a more biological properties. It promote the periodontal reconstruction, even the amniotic membranes also. And next important is amniotic fluid. So it acts as an injection for the patient suffer from chronic pain, sports injuries, arthritis, or it can repair or regenerate any injuries without surgery. They will use the amniotic fluid injections. And amniotic fluid contains more nutrients and growth factor. That's why it has more proper healing and fast healing, because of it has abundance of collagens, cytokines, elastins, and growth factors. That's why they have used the amniotic fluid as a healing process. So we can say we can see this table. The amniotic fluid has fast treatment, pain-free treatment, growth factor, antimicrobial, and also anti-inflammatory factor, all will be there. Compared to the platelet, corticosteroid and hyaluronic acid, compared to other things, the amniotic fluid is the very best and effective for utilizing the wound healing. So thank you for your attention. Any queries, please share me. So I want to tell one thing. So today's this viral photo. So the doctor is after delivery, the baby is taken out the face mask from the doctor's face. So it shows what they are saying. It is a good sign from the pandemic situation. So I hope all of you to take care and be safe. Okay. Thank you all.
Thank you, ma'am. Thank you for
Thank
your
you.
informative speech, ma'am. Really, it is wonderful. And
Thank you.
we gathered so many information regarding Amnion harvest, and a few questions we received from MedSurg department. Shall I read, ma'am?
Yes, ma'am.
Okay. The first question is, uh, will amnion membrane used in diabetic foot wounds?
Yes,
Whether
ma'am.
it can be
The
used
first,
for a diabetic?
yeah, ma'am. First picture itself I have shown.
Oh,
In
okay,
the
okay, ma'am.
foot diabetic foot, it can be used any wounds, ma'am. Not only diabetic, any wounds in the skin, even it is the second degree or third degree, any wound type
Okay, ma'am.
can
Is
be
there any
used.
cosmetic purpose they are using, ma'am?
Yes,
This
ma'am. For
uh,
the for the skin, if they are having more infections, even the redness or not like cosmetic therapy means
the
they
skin
want to
lifting.
reconstruct this.
Yes, ma'am.
Not like that. Not
Okay,
like that, ma'am.
okay,
Only
ma'am.
for infections.
Okay, okay,
Okay,
ma'am.
not
Okay,
for
ma'am.
cosmetic therapy.
Okay, thank you, ma'am. And one more question: whether it can be used in other farms, ma'am? Other farm, only the layer can be used, or it can be used in any other
Yeah,
farms, like.
yes, ma'am. The second picture I have shown, it can be used in the injection for the
Okay,
MI therapy for myofuction, and also they can use for the gel. They can apply on the skin directly. The gel
oh,
wise they can use, or they can use in the layer, or they can use in the injection, any form of according to how they are preserving.
okay, ma'am. Thank you, ma'am. And
Either
one
they are
more question,
preserving
ma'am.
through like a powder form. Okay.
Okay, ma'am. Okay, okay, ma'am. Powder form and gel form.
Yes, ma'am.
And one more question also there, ma'am.
Okay,
And
ma'am.
whether the amniotic fluid can be used for treatment purpose?
Yes, ma'am. The last slide I have said,
The
not only
fluid
amnion,
also.
amniotic fluid is having so much component compared to amnion. Amniotic fluid only is using for many components. So it has more components. So they are utilizing for all the joint pains, even the arthritis, sports injuries. They are utilizing as a injection. Amniotic fluid
Okay.
we can use only like a injection form. We can't use other like because it is fluid, no, ma'am.
Yes,
from
ma'am.
the from the pregnancy itself they will take through the amniocentesis and they will utilize for the other conditions. It has many components.
Oh, thank you, ma'am. And one more thing, ma'am. Uh,
Yes.
whether it can be modified as a cardiac valve replacement for
No,
cardiac
ma'am.
replacement
Well,
procedure. It
no,
can
no,
no
no, ma'am. Only skin the outside. Okay, or they
outside the.
can make a adhesion layer like
Oh,
for cranial surgery, for any type of surgery. They will
okay,
along with transplant of the any organ, they will make the amniotic membrane covering to prevent adhesion formation of other things, other organs.
okay, ma'am.
It
Thank you.
is not act as a complete transplant like a wall transplant muscle.
Okay. Yes, ma'am. Understand. Thank you, ma'am. Thank you for your patience in answering all the questions. Uh, now we come to the end of this series. I hope this webinar is very much useful. And um, if there is any queries, you can ask. This is a question we received from the live chat. Anybody want to ask question? No. Thank you, ma'am. Have a pleasant noon. Thank you, ma'am.
Thank again. I'm thanking the management and most respectable principal, Dr. Helena ma'am, given the wonderful opportunity to present that this topic to everyone. Uh, I am thanking so much, ma'am.
Thank
Thank
you.
you, ma'am.
Thank you once again. God bless you. It was wonderful presentation, and I think most of the students would have got some idea what are the newer technologies and newer modalities on Amnion. So a lot of information
Okay.
we were able to take it up. Thank you. God bless.
Thank you, ma'am.